Dealing with smaller fibromas, it is sufficient to work with a disc electrode. The bipolar tweezers electrode is part of the optional accessories and was developed especially for the removal of pedunculated warts and fibroma pendulans. It can be used with all electrosurgical devices with bipolar functions. The fibroma is seized by the tweezers electrode at the base and coagulated through a pulse triggered by the foot switch. With this simple and quick method, no afterbleeding occurs, as all leading vessels are coagulated. Xanthelasmas are coagulated also by the disc electrode to skin level. The disc electrode is led over the treatment area with a very slight pressure. Seborrheic keratosis is also removed by only a very slight pressure of the electrode on the skin. The coagulated substance should always be removed by a swab, never with the electrode, because the basement membrane must not be injured in order to prevent the development of scars. When removing overpigmentations, you also work with only a slight contact to the skin. When the epidermis has changed into a whitish color, the target of the therapy is reached, and the coagulated material can be removed by a swab. This electrode is used for epilation in the area of the upper lip, the chin, and the so-called bikini area. When epilating, the electrode is led 3 to 4 millimeters into the skin and a coagulation that lasts for 1 second is performed. When the electrode has been placed properly, the hair can be removed from the skin without any resistance. At this point, we'd like to indicate that the theory and the single steps of the wrinkle treatment and the removal of tattoos are described in detail in the operating instructions booklet. Please pay attention that the electrode has to be led always away from the eye. Before starting the treatment, it is recommended to inject a local anesthetic. With a slight intensity of pressure, the upper epidermis is removed. Please be careful to coagulate superficially just the surface. It has to be coagulated 2 millimeters more over the edge of the tattoo, as during the following scabbing, otherwise, through dehydration, a temporary shrinking of the upper skin levels can take place. In that case, there would be the risk that pigmentations at the edge of the tattoo will not be removed. In the next step, sterilized grain sodium chloride is applied on the area that will be treated. Afterwards, the area is covered with a sterilized compress, which is fixed by an elastic bandage. 5 hours later, you remove the bandage and the salt and clean the treated area with alcohol. After about 3 days, a scabbing develops. This has to fall off by itself after 3 to 4 weeks.
As you could see, the applications are easy for you to learn. They are minimal invasive and are tolerated by the patients very well. In many years of experiences, it has turned out that the patients appreciate to visit a separate aesthetic consultation hour. All treatments should be accounted for privately, because health insurances do not pay for cosmetic corrections. Treatments should not be performed in the case of the following contraindications: cardiac pacemakers, pregnancy, high fever, inflammations in the area to be treated, and in the case of not clearly benign skin symptoms. We thank you for your interest and for watching this film.